Hi, welcome to my channel. My name is Kate and here I share practical and science-based information for parents, as well my own discoveries in the parenting journey, and occasionally I interview well-known experts in the field of parenting. Did you know that around 80% of women are afraid of birth? And I think for many of us who gave birth or ever been pregnant, this feeling of anxiety and fear is quite common. So you're not alone if you're feeling anxious, maybe frustrated, maybe fearful of the future event. And in this video, I'm going to share several tips on how to minimize your anxiety and actually how to feel more stable and confident and just maybe open to the experience of birth and what it's going to bring to you. And watch this video till the end because I'm going to share some resources and books, and I hope they will be useful, and if so, please don't forget to like the video. So first one, which I found really useful for myself, is do your homework. So prepare yourself and educate yourself, but not only about the medical aspects of what birth is and how the hormones are working and what actually limiting the work of these hormones, what kind of medical interventions can intervene in the birth process and the way our body mean to work and make your birth experience more difficult. But also educate yourself about the stories and what other women around you and maybe generally in the world experience. Like, what are the positive moments? What were the negative stories, the positive stories? The second point is build connection with your healthcare provider and really try to find the doctor who is going to support your values and the way you want your birth to happen. This is super important because during the birth, we are probably the most vulnerable creatures. We don't have energy and space to actually manage the situation. So we need somebody who is on our side. And doctor should be someone, if he's going or she's going to play the main role, not the main role, but the big role. You're going to play the main role. The big role in the whole setting and experience. I think it's important to have someone who is actually shares your own values. So one, try to find the right doctor. Second, build the relationships with this person. Like, try to talk through all your fears and strategies, how you can mitigate them, and just share your concerns, but also share what are your expectations, what are your aspirations, what you actually want this experience to be. And you can go really beyond the just medical setting and just beyond the physical experience, like how you want to feel yourself, what is important for you. That's probably not a common conversation with the doctors, but I really encourage you to have one. The next point, which I also really highly recommend to consider, especially if you have an anxiety and fear and you have a lot of negative stories around yourself, like the birth was awful, it was super painful, etc. Consider to have doula or midwife. And actually data says that having a doula reduces the amount of medical interventions and the whole experience is much more positive for women and partners when they give birth if they have doula. Doula is someone who actually can stand for you and your partner as well if you're considering having a partner at your birth, but you have to bring them in a team. That's probably my next point, is to have to set up a really great team, like somebody who is going to stand up for you, for your rights and for your expectations, and who is going to do the whole talking. So I had doula and I had partner at my birth, and I found that it was super useful because it reduces the amount of unnecessary interventions. I didn't have to do the talking because science says us that if we start to talk and have a conversation during the birth, it actually reduces the amount of some hormones that help the birth to be more smooth and more positive. So minimizing your need to have a conversation and being able to soak yourself in this experience and connect with your body, this is very important. And then that's why you need some people on your side like doula and your partner who is going to do this management bit. The next one is plan your birth experience. But what is important for planning, it's not like, again, only about like what is going to happen in medical and physical terms, but also how I want to feel myself. And what is really useful is you probably want to do some visualization, and I actually wanted to show you one of mine. This is something that I created before giving birth, like talking to myself and really trying to find the pictures which will resemble more like the way I want to feel like, for example, this is, I think that's me and my partner, for example, like we're doing drums. So I wanted him to be sort of on the same wave as I was. That's why I wanted to have doula who is going to help me. And this is like a line. I wanted to bring some wilderness in this experience and really try to connect to my body, to nature, and to some more probably deep and ancient feelings. So I really highly recommend to, probably you do something like that and try to visualize how do you want your birth to be. But at the same point, what is important, I think, is to plan for unplanned, like for something that you don't want to happen. Like, for example, you want to have a natural birth and then something is happening and you're going to end up with the C-section. Leave your plan open. Make sure that it actually embraces different possibility, because birth, as the birthing from within methodology says, for example, it's always brings some unknown. Leave a space for this unknown. Make sure that you embrace all the possibilities, because by the end of the day, it doesn't matter how you're going to birth, like is it going to be a C-section, a natural birth, epidural, whatever is going to happen. I think what is important is how I can stay connected and true to myself in the given circumstances. I don't want to, blame myself afterwards that I didn't manage to give the birth in the way I wanted. This is the last thing that you want to have after birth. We're going to have something which is given to us, and how we can be really connected to ourselves. So that's, I would probably consider as sort of a task for myself if I would be giving birth next time. Another one which I really highly recommend in case if you feel fear or anxiety is try to consider the therapy. So find a space where you can freely talk through all your concerns and anxiety and whatever comes to your mind, whatever possibilities are floating in your mind. Really consider this, or alternatively, if you don't want to go to therapy, try to find a group of like-minded pregnant women or just mothers in your area, and maybe go to these groups, try to connect to people, talk to them, listen to their stories. Sometimes doulas actually do this kind of gatherings, and they could be super useful and supportive, especially in postpartum period. And that brings me to the next point, which is plan your postpartum, and again, be ready in terms of even the mindset, not just like what kind of bed am I going to buy or what kind of clothes is, but more of a mindset, like be open that the postpartum could be really difficult experience, but it could be a wonderful experience. But we need time and space to recover on a level of a body, on a level of a psyche, on a level of a spirit, and we need to give ourselves this space and be really gentle to ourselves. And there is a really great book, probably one of the best that I personally encountered. But if you in mind other books on postpartum, just comment and let me know what you found useful for yourself. But the one that I want to recommend for postpartum, which is called First Trimester by Kimberly Ann Johnson, it goes specifically in this topic of not just recovering on a physical level. Again, I think that many challenges that we encounter during birth and after birth are really tied into the way we generally live. You might notice that I really encourage you to discover birth and postpartum something as not just a physical event. And I think that many fears, even the fear of like I'm going to feel pain, my birth is going to be super painful, that's why I need like some sort of painkillers, they also the root causes, the roots of these expectations far beyond the physical level. So I probably overheard stories of birth being painful, at least I did. I was like, when my mom told me how she was giving birth, I was like, I don't know how I'm going to do it. And that's sort of, and it's probably, but I wanted to have a baby, but I didn't want this to be such a traumatic event. So I started to discover how it could be different, how I can challenge the norm that I see around. So, and that's probably my last point, is try to challenge a little bit the experiences of people that you have around and the norm, that's something that you feel as a norm. Like everybody has natural birth, but if I would have a C-section, I'm not necessarily ending up with the natural birth. What will happen? Would I feel like I didn't manage to stick to the norm, or vice versa? Like everybody is having a C-section, like what I want to have. And again, more of not just like what kind of procedures are going to happen, but what are my expectations, how I want to feel myself, how I want to connect to myself, and really use this, I wouldn't fear this word, like life-changing experience, because it really is, how I can use this life-changing experience, do something differently. And quite often how we live is going to show in the birth itself. Like if I'm a people pleaser, for example, there is high chance that my agreement to the doctor's proposition to have some extra intervention could be only partly motivated by the fear, but some of it is going to be this people pleaser that it just doesn't want to, create waves with the doctor and just agree and please people. I encourage you to look at birth first as something that goes much beyond the just physical experience, and also use this experience to do something different, because afterwards you can find a huge strength in this. Like you have this embodied experience of, for example, standing for yourself, or really doing something that is more true to yourself, or overcoming, something that was really a negative experience, and you managed to go through it and still be connected, what's important for you and to your baby and to your partner. So that's something, that experience is becomes so deeply ingrained in our body and brain, that then further in life we can actually rely on it. It becomes a sort of a pillar. And of course, when we think about preparation for birth, we always think like, okay, what kind of apps would I put on my phone? Like how can I track the baby development? How I can make sure that I have a right OB, or what I'm gonna do. Am I going to do epidural or not? Stuff like this, like how I can actually do it on a physical level. This is all great, but at the same time I would highly recommend to read some books which probably go a little bit outside of conventional point of view of birth as a physical event, but see this event also as a psychological experience and spiritual experience, and what kind of footprint it leaves in our life and in our body and in our psyche, and what comes afterwards. Those are the 3 books that I highly recommend to have a look if you are preparing for birth and you actually want to reduce the amount of fear and uncertainty and anxiety that you might feel. I personally found super useful the book of Michel Arden, Birth, Rebirth, How the Childbirth Should Be, and that book might feel a little bit old-fashioned in terms of the topics that not the topics, but the settings that he is speaking. Some examples are quite old, but the most useful bit was, which actually gave me a lot of thought on how the current birth experience is structured for many women, like highly medicalized, for example, and what I want for myself, like for what kind of experience do I want. So that book was super useful in terms of understanding better myself and challenge a little bit the current traditional way of giving birth. The second book, which I also highly recommend to have a look at, is the recent book of Gabor Mate, who is the world-known psychologist, The Myth of Normal. And there is a whole chapter on birth specifically. So if you have a chance, or maybe you have this book around, like look at this chapter, because he's exploring how the birth experience is actually leaving the traces in our body, in our psyche, and could be quite traumatic if structured in a way that is not really healthy for our psyche. And the third book is Birthing from Within, The Extraordinary Guide for Birth Preparation by Pam Englund and Rob Horowitz. We actually have an interview on our channel with Nikki Shahid, who is the birth mentor from the methodology of Birthing from Within. What is particularly interesting about this book, it sees, and the whole methodology of Birthing from Within, it sees the birth as something not just a physical event, but psychological event, spiritual event. And it's almost every time brings something which is unknown. And they talk about birth as initiation. It's super interesting point of view and was for me personally very useful. And I wish I knew about it more when I was preparing for my birth. You can actually watch the video with Nikki Shahid, the link is over here, when she's talking about this methodology in more details. So I hope I gave some useful insight in this topic of birth and why we actually feel a lot of anxiety and fear, and this is such a norm. So I hope this video was useful, and if so, please subscribe to our channel. Don't forget to like the video, and see you in the next video.